Good morning, everybody. We're going to go ahead and give people about 2 more minutes here to continue getting logged on, and then we'll go ahead and get started. All righty. Good morning, everybody. This is Tyler Finken, Health Marketing Director over at Western Marketing. First off, I just want to say thank you to everybody for joining us this morning on this very, very informative webinar that we've got going on for you. Today, we're going to be going over the CSG Actuarial EAP system, and we have the wonderful Anna Patrick, Director of Strategic Partnerships at CSG and Integrity with us today to put on this webinar. I do want to say a couple things before we get started. Number one, there is a questions box on the right-hand side of your screen there. So if you do have any questions throughout the webinar, please go ahead and type them there, and then Anna and I will do our best to answer them at the end. So I know everybody is busy, so without further ado, I'm going to go ahead and turn it over to Anna, and we're going to go ahead and get started. Anna, thanks for being with us today.
Yes. Thank you so much. And thank you everybody for your time as well. It's really important that we get you up to speed on the CSG Medicare Supplement e-application because we have good news coming this year on integrating the CSG Med Sup coding tool inside Integrity's Medicare Center. So right now, if you are utilizing MedicareCENTER for your Medicare Advantage or PDP, you'll notice that you can quote and enroll in there. Soon we will be adding the CSG Medicare Supplement into there as well with these e-app functions. So we do want to make sure that you are up to speed on it. That way we can get you submitting apps in that platform as well. I have our generic CSG kind of testing tool pulled up. So it does say your logo in the upper left-hand corner, and the colors may look a little bit different from what you're used to utilizing on Western Marketing's quoting tool, or if you are utilizing the CSG app inside MedicareCENTER. But what we're going to walk through here today is the process for submitting an e-application. I am going to use AFLAC as an example. AFLAC was a recently added carrier to the platform just 2 weeks ago, but we do support this particular platform for other major carriers like United Healthcare, Mutual of Omaha, Aetna. We have powered this for ACE, Woodman, and we'll continue adding additional carriers to this platform. So what the great thing about it is, although I'm going to demo AFLAC here today, it's going to be the same process and the same look and feel no matter the carrier that you are going to be submitting the application on. From carrier to carrier, there may be some differences as far as what their required fields are within the application, how they have their health questions, maybe some of the underwriting logic that they use. And I'll describe some of those scenarios as I'm going through this training here today. And then the only other difference, as well as some carriers may have different signature options than others, but the look and feel, the process will be the exact same. So we're going to start running this quote just like you normally would run a quote in CSG. You don't need to create a client. You can just type in a zip code, age, gender, tobacco status, plan type, if you want to include a household discount or not include a household discount. And then just always make sure that you move your effective date forward to the effective date of the carrier that you're doing the application for. So what that effective date is. We will have all of the future rate adjustments already loaded into the tool if the carrier has communicated that and shared it with the field. So if you are doing maybe an April or a May, you can still type those particular effective dates in here. So you will see the carriers that are supported on the e-application. So just for this test account that I'm in running a Dallas zip code, you can see all the carriers that we support on the platform. When you are running a quote, you will be able to see that apply now button on the far left-hand side of your screen. That just means that we support that carrier on our e-app. It does not mean necessarily that you're contracted with that carrier, but that we do support them on the platform. Before you end up hitting that apply now button, just make sure that if you do want to include the household discount in your monthly premium, that you do apply those discounts on the far left-hand side underneath that adjust view. That way the proper rate carries over for you. Now, most of these carriers, as you're going through the application, if you make any changes to the application based upon your initial quote, so if you quoted it with a household discount, but you answer yes to the household discount question, or I'm sorry, if you quote it without the household discount, but you answer yes to the household discount question in the app, the rate, the premium would adjust within the e-application. So most of the major carriers will make those changes for you. Or if you change the effective date in the app, maybe you change the plan type, all of that would end up changing the premium in the e-app. The only carrier that we don't change the premium for is Allstate. So if you are doing an Allstate e-application, please make sure that you have quoted it properly with the right household discount and with the right rating class. They do have multiple rating classes with their wearable discount. So just keep that in mind. Allstate, you do need to make sure that you have quoted the proper plan before hitting that apply now button. But every other carrier will show you those rates. A couple of things, if you are submitting a AARP, United Healthcare, Medicare Supplement in here, we do quote them with the EFT discount. We also will quote them with the household discount. But when you do the e-application in the platform, they remove the EFT discount and they remove the household discount just while you're going through the application process. But once you have submitted it to the carrier and you are doing an EFT, or they do qualify for that multi-insured discount, they would apply that to the premium. So those are just a couple of differences with some carriers that I wanted to explain to you as we're going through this demonstration here today. So as I mentioned, we're going to do AFLAC as our example because we have recently launched AFLAC. Now, the first time you submit that apply now button, it's going to ask you to validate that you're appointed with that carrier. Some carriers will ask for your national producer number. Some carriers will ask for your writing number. So just pay attention to what that carrier is asking for. Whoops, I'm going to get hold on one second. I'm going to get the proper national producer number in there. I must have copied and pasted wrong. So hold on one second. Let me get that pulled up. The great thing about this too is we are validating the NPNs in real time. So what we do here is we ping the carrier's database and we validate that your national producer number is valid. And then it will say settings updated there for you. And then it will take you right into the e-application. So just make sure that when you are doing the application, you're validating with the proper one. Once you enter in that national producer number or writing number for the first time, the system will remember it. That way you do not have to enter it in every single time that you're doing the application. In the settings icon in the upper right, this is where you can always adjust what you have as your writing number or your NPN. You shouldn't need to, but in case you ever do, that's where you can do it at. In this particular case for Aflac, it does carry over the agent's name with their writing number, although we validated with NPN. Just keep that in mind. And then with Aflac and then other carriers on the platform, most carriers will support just in time. So in this particular example, I'm contracted, but I don't have Texas as my license on my state license. But if I end up submitting this over to them, they would just in time appoint me for that particular state. So you'll still be able to submit those. But that's just an example of a notification that may appear as you're going through the app. Now you'll notice on the far right-hand side, it does carry over that monthly premium that we quoted. You'll be able to see all of those initial quote details there. And then underneath the quote details, we have all of the initial documents. So if you needed a copy of the outline of coverage, the disclosures, the guide, a blank PDF application, you can capture those documents initially. At the very end, once we go through the signature process, you will be able to get a copy of all of the documents, including the filled out PDF application at the end. And you can also send these over if you need to send them to yourself or your client. Again, this application would be blank until you go through and you fill it out at the very end. You also have your notification section. So your notifications will alert you of any errors as you're going through the application. Some of those errors may be selecting the wrong underwriting type, answering yes to an automatic decline health question. So we would alert you of notifications. If you are doing a fully underwritten app and you answer yes to an automatic decline health question or you enter in a declinable drug, we will just deny that application and will not allow you to submit it. So we have some safeguards in place, but we do work directly with each carrier to really understand their underwriting criteria. That way you have a good indication if they would end up passing underwriting. Now, depending on the underwriting type that you select, you'll end up getting certain sections on the far right-hand side that you will go through and complete. Those are grayed out until we end up selecting the proper underwriting type. Now, if I click on the I icon, that just gives us a full description of what it means to be fully underwritten, open enrollment, or guarantee issue. In this example, I am going to do an open enrollment, but we'll get into another application after this one and show you the fully underwritten components of the platform too. If you do have a state that you're doing that has the birthday rule, for all the carriers supported on our platform, we require the birthday to be part of open enrollment. The only carrier that has it differently is ACE, and ACE has birthday as a guarantee issue. So birthday rule for ACE, you would use guarantee issue. But the great thing about this is the system would notify you if you ended up selecting the wrong underwriting type. So plan eligibility, you would just enter in your client's date of birth, their Medicare Part A and Part B effective dates. You can enter those in here. And you can either use the drop down menu or you can use your keypad to type in that year. I do find utilizing the keypad is easier than going through the drop down menu. So all you need to do is hit continue after that particular section, and then it will populate sections on the far right hand side that you will need to go through and complete in this application. That yellow air icon means just that there is missing information in that section, or there is an error. Green check mark means that section is completed. So it automatically shows completed because I initially ran it without a household discount. So it just has no as the household discount in there. But we'll go through that section here in a bit. Anything with a red asterisk is going to be a required field. So this is where you may end up having different carriers require certain fields within the application. So kind of keep that in mind. The zip code, city, state will carry over from the quote. The mailing address, if it's different, so if you do have a client that has a PO box that they would rather use, you can select yes and then have the option to enter in that PO box. With the phone number and email, we do have 2 signature options for AFLAC that you can use email or phone number or text for. So that is good to enter that information here, but we can always adjust it on the actual signature page. So phone number, email, again, email is not a requirement, but if you do want to send the documents electronically to your client or have them e-sign, we will need a signature, an email at the signature portion of the application. Gender, height, and weight. I always get this question here. So some states will have height, weight, and tobacco as required for open enrollment or guarantee issue. It is a state-by-state basis. So again, we are going off of what the carrier's required fields are in the application for those states. So some states would require it, some would not. So I am going to go ahead and enter those in here. Tobacco question, and then are you a legal resident? We can select yes, and then we can hit continue. Now you'll notice there's no save button in here, and that's because the system is automatically saving as you go on and you hit continue on each particular section. So it is going to auto save, and then you can always hop back to a particular section if you ended up missing something. So here I forgot to press, is the mailing address different? No. So then now it's saying that it's good. So I can just hop to the next section. The household premium discount information. So although in the quoting tool, we will show you if it's a roommate or a multi-insured, but we will show the full definition here in the application. So if they do qualify for this, you can select yes and then enter in the spouse's or roommate's information in this section. And then again, most carriers, that premium would end up updating based upon how you answer that household discount question. The next section is the Medicare information section. You'll notice that the Social Security number is a required field. However, the Medicare card number is optional. Medicare Part A and Part B dates carry over here for us. And then, are you applying during your guarantee issue period? We're doing open enrollment. That's why guarantee issue period is no. And then, did you turn 65 in the last 6 months? And did you enroll in Medicare Part B? So this is where we can enter in those dates, and then we can hit continue. Now, in the previous or existing coverage information, based upon how you end up answering these questions, you would have different prompts that come up. So let's just say, for example, if I was switching Medicare supplement policies, if I had one currently in force, this is where it would then ask me additional questions on that particular plan, company name, and plan type there. So again, depending on how you answer questions, you would have different fields that populate. Have you had coverage for any other Medicare plan other than original Medicare in the past 63 days? I know we had a lot of Medicare Advantage clients look at Medicare supplements because they were terminated. Their plan was terminated, so they had a guarantee issue period. So, if your client was that particular case, that's where you would select yes. Have you had any other health coverage? So if they did have a particular like coming off in a group or an employer's plan, it's where you would select yes there. So again, depending on how you answer those questions, you would have additional fields that would populate for you. Then we can hit that continue button, and we've gone on to the next section, which is the payment method. So you do have, for some carriers, the opportunity to do a wet signature. And what a wet signature is you filling out the application electronically. And then at the very end, before you get to the signature portion of it, you're going to print off that application with it filled out. So you'll have a physical piece of paper that your client would sign, and then you would have to mail or fax that into the carrier. So if you do a wet signature, you would have the option to pay your initial premium by check, and you would have to send in a voided check with that piece of paper of the application. If you want to do everything electronically and sign it electronically, you would select no to printing for a wet. Payment option would be automatic bank withdrawal. Draft for initial premium upon effective date or policy approval. We can pick effective date there, and then how we want to continue paying that, whether it's annual, semi, quarterly, or monthly. And then if we were doing monthly, we can pick the particular draft date. We can do a checkings or a savings account for paying that electronic funds transfer. You can just start by typing in the routing number, selecting that, and then that will carry over the bank name for you. And then you can type in the account number and then the first name and last name. Now, if it is a husband and wife and they're sharing a bank account, please only put the applicant's first name here. So if Darcy was married to Bob and they share a bank account, you would just put Darcy's name in there. If somebody else is paying for their monthly premium, we've had this happen before where maybe their adult children are paying for their MedSup monthly premium. If that's the case, that particular individual who is paying for the monthly premium, there will be a piece of paper that you'll have to have that particular individual sign, and then you'll have to send it into the carrier afterwards. So just kind of keep that in mind. In this case, I am going to select no to that and then hit that continue button. So the last section is going to be the to be completed by producer section, where it's just how you want to deliver the policy, whether that's to the applicant or the producer, how we want to deliver that electronically. Have you truly and accurately recorded the information? They reviewed it for any false statements. Yes. And then here's where you would type in your first name, your last name, your phone number, your producer email, your address, zip code, and then city, state. If you had to provide any type of supporting documents, you can see we have the notice of termination or an evidence of coverage. You can do that. You do need to upload a PDF. So we can only accept PDFs for our uploads. So you would have to choose that particular file. Once you choose it, you'll upload it, and then you will go ahead and add that entry. If you are doing any type of split commissions, you can select yes and provide that agent's information as well as the percent that you want to split. In this case, I'm going to select no to that, and then I'm going to hit verify application. So verify application just gives you one last opportunity to review that application start to finish before you end up locking and e-signing. So you will be able to edit a particular section. If you notice you made any mistakes there, you'll be able to see that. And then when you're all done reviewing, we can hit lock and e-sign. So this will now take us to our start of our signature process. Now, at any time of this, if you need to wait for that client to be available to do their signature, especially if it's electronically, you can always get out of the application. Remember, this does save for you. It does save in your eApp dashboard page, so keep that in mind. If you wanted to print these particular disclosures, you have that opportunity, but then we want to click on agree and continue. This is just agreeing to do the electronic signature. And then here it's going to ask you if you're in the same physical location or not. So depending on if you are in the same physical location, you have all three signature options: applicant providing identification information, email signature link, or text signature. So Some carriers, their opportunity for signature types will end up varying, so just kind of keep that in mind. But in this Aflac example, we have all 3 options. If we're not in the same physical location, we have the opportunity to do an email signature link or a text signature link. So if I'm just going to be doing if I'm in the same physical location, I'm going to walk you through the steps for applicant providing identification information. What you would do here is you would open up each document, and then each document would open up in a new tab for you to review. So this is you just going through this with the client. So you will have an opportunity within your web browser, like mine uses Adobe. I can always, print these particular items off or save them. That way I can provide the client with record, the choosing a Medigap guide, as well as the PDF application. So just notice when you're completing it with a consumer, everything's going to open up in a new tab for you to review that document and then go back to the actual application. Once you've opened everything up, you will then check mark, I have received, read, and kept a copy of the above documents. And then we can enter in the mother's maiden name, and then we will type in the last 4 digits of the client's social security number. So you'll type that in, and then just acknowledging the city, the state, as well as the zip code. And then apply e-signature. It carries over the producer name for their signature, and then the producer, you would just click apply e-signature. Once you're all done with those, the blue sign application button would appear. If that does not allow you to click on sign application, it means that you didn't check mark one of these boxes, or you didn't open up all of the particular documents. So keep that in mind. Now I'm going to walk you through the email signature link process. We have updated this process, making it extremely easy for your client to sign by email or by text. I'm going to demo the email signature here, start to finish. Just keep in mind the text signature will be the exact same. It's just instead of receiving an email, they will receive a text message, and they do need Wi-Fi or internet to be able to electronically sign it. So you'll notice here in the email signature link, it does carry over the email that I had in the application, but I can change this here if I need to now. And then the text message, this is where you can enter in a cell phone number. So if on the first screen with the applicant information section, if you entered in a home phone number, they want to use a different cell phone for their signature, this is where you have the opportunity to type in a different phone number. But we're going to keep it on email signature link, and then it's just going to say producer name, producer number, and then we'll hit that apply e-application down here below. So then I will be able to hit sign application there. And then it's going to tell me that it has been producer signed. Now, your client is going to have a 2-hour window to sign it by email or by text message. So that's the case where you may not want to send it over to them unless you know they're ready to receive it. So this just says pending applicant signature. I have an opportunity to gather all of the documents right here if I need them. Otherwise, I can go into my e-application dashboard page now, and I will be able to see that we're waiting for the client to still sign it. So in your e-applications is where any incomplete or submitted apps will end up storing. You can see right here it says producer signed, so we're still waiting for the client to sign it. Once the client signs it, it will say submitted on it. You do have a quick link here to resend the signature to Darcy Smith. So if it's past that 2-hour window, her verification code will not work. So that's where you can resend the signature. Or if she is reviewing the application, she found errors in it, you can hit edit to make any corrections and then re-go through that signature process for her to sign it. If you end up clicking edit before Darcy ends up signing it, it will end up voiding that verification code that was sent to her. So keep that in mind. Now I'm going to go ahead and pull up the email here and we'll review what the client will end up seeing. So here is the email here. It comes from your agent. So it'll say your agent there. Then it says Aflac underwritten by Tier 1 insurance company. So with this particular email, you will notice it comes from a do not reply at csgactuarial.com, but you are CC'd on the email. So you are CC'd right here. You can see my email address is CC'd there. That way I can see what my client did and verify that it got sent to my client. So here is the email that they receive. They receive a code as well as a link to verify their signature. So if you're on the phone with them and you want to read this code off to them once they get in verify signature, that's fine as well. If they are receiving a text message, they'll receive the code and the link in the exact same text message. So it's one email, one text with both information. So on this page is where they will enter in that verification code. So I can paste that in, type that in, and then the applicant's date of birth. This date of birth needs to match the date of birth on the application. If it does not, it will not verify. So I have had agents that had the wrong date of birth in there where it wasn't verifying. That's a case where you would have to go in and edit the application. So here's where we can click verify and continue. And then you'll start noticing here, if you've previously submitted e-applications on our platform, this is all looking a little bit different for you now. So everything that your client does is done on one screen now. So we're not taking them through multiple screens or pages. Everything is done on this screen. So we're showing them the 4 steps they're going to go through. First is verifying their information. The next step is just agreeing to do the electronic signature. So they are agreeing and continuing to that. And then the next step is going to be to review the documents. So all of the documents that they are going to review are embedded on the page for them. So they no longer have to open up the documents. So they're all just embedded on this page for them. On the far kind of upper right hand corner, you will notice 4 dots over there. The first one is highlighted in blue. That just shows you that there's going to be 4 documents that they're going to go through and review. And then they do have an opportunity to download that document here. Otherwise, at the very end, they're going to have an opportunity to download all of the documents at one time. So all they need to do is click through, acknowledge, and continue for each of the documents. So outline of coverage, the disclosures, the choosing a Medigap policy guide, and then the actual application. So they can just use their mouse to scroll through here. Again, they don't have to open it. They can just scroll through like I am now. And then when they're done, they can just click on acknowledge and continue. So you'll see all 4 documents have been opened. If they need to download the documents all at once, that's the button at the very top where they can download all the documents. Then they're going to click on the blue confirm and continue. And then their signature, which would be their zip code, and then it will populate their city and their state for them. So very easy process for them now where they're just on one screen. They can see their progress over here on the far left-hand side, verify, consent, review, and confirm. And then once they're all done, they can hit complete signature. It's going to say, thank you for submitting your policy. You can now safely close out of this window. So you will be able to see when your client ends up submitting the application just by refreshing your page here. I am in a testing environment, so mine does not successfully deliver to the carrier. So mine will say submission failed, but that's on purpose. We don't want to send it over to the carrier. But you will end up getting a policy number when you do have that submission, successful submission. So what a successful submission would look like would be like this ACE example where it just says submitted. So that's how you'll know that it has been successfully submitted. And then you can always view a copy of that PDF application. And there's also a link out to the agent portal if you need it. So options for you there. And then I'm going to just quickly go into an application here that I've started. So I'm going to click edit application. This just shows you how you can easily go into an application. I wanted to show you, if you were doing a fully underwritten app, just those additional health sections and then some errors that you may see populate. So if I was clicked on fully underwritten, but my plan eligibility does not depict that I'm going to be fully underwritten, it's going to be open enrollment. When I hit continue, it will end up giving me an error notification letting me know that I have selected the wrong underwriting type and that my client is actually a fully underwritten. So it just says based upon the it's going to say they're currently eligible for open enrollment instead of that fully underwritten like I selected. So you'll always get those notifications that pop up in the bottom right-hand corner for you. And then if you go into the notification section at the very top, that's where you'll also see that particular error. And then with the underwritten app, you're going to see 3 additional sections: the health information, the health history, and then physician information. So if I go into health information, this is where we have word for word all of their health questions. So if you select yes to one of the automatic decline health questions, we would tell you once you go ahead and hit continue or go on to the next section, we'll end up sharing you that that application has been denied. So you can see that notification popped up in the bottom right hand corner. The application will not be issued coverage because you've answered yes to at least one health question. You'll also see here that this says denied. In health history section, this is where if you are taking any medications, this is where you would enter them in here. Notice when you are entering medications for Aflac, they're just asking you for the medication name. So you can just start by typing in a drug name. It's going to populate options for you. And then you can just type in the reason you're taking that drug and then hit add entry. So that's where you can easily just type in medication name and then the reasoning. We don't need to ask you for any dosage amounts, but just make sure that you click add entry and then that entry comes down here below. And then the other section that you end up receiving for fully underwritten is the physician information. So if they need to enter in their primary physician's name, office, phone number, and then location. And then if they see any type of specialist, this is where they would enter that in here. Again, just make sure that you end up clicking add entry once you add that specialist information. If they've seen any other physicians other than the ones listed in the last 24 months, you can select yes and then add those additional physicians in there. So those are the 3 additional sections that you would end up seeing depending on if you're doing that fully underwritten of the app. So that is the e-application process, just going through it start to finish. Wanted to show you the full steps for doing open enrollment and then plus showing you those particular health sections. Keep in mind all of those e-applications that you do in the platform do store here underneath your tool section in e-application. So you can always come in and click on view active in order to see any of your incomplete or submitted applications. So I'm going to pause there, and Tyler, if you want to let me know if there are any questions, I'm happy to answer any.
Well, thank you, Anna. Certainly appreciate it. I do not have any questions on there at this time, but I know every once in a while some people might wait till the end to put those in there, so we'll give it a minute or two to see if any questions pop up. But that was fantastic training on the application process. I know we've got some people that are already using it, and then others that we're not familiar with the system, but we'll probably start using it now. So hopefully we can get more and more applications going through there, because it does seem a lot easier than having to go through each carrier portal. So if anybody does have any questions, please feel free to type it in there. Otherwise, we'll try to give some of you guys a day back here. Anna, is there anything else that you want to add before we go?
Yeah, just to note that if you do run into any technical issues with the application, please just always make sure that you reach out to our EAP support team at CSG. We do have a team that is answering phone calls live, as well as checking emails and things like that that you end up sending in to us. So just make sure any EAP hiccups, if you run into any, please reach out to us immediately so we can help you through that. If you ever do get a submission failure for whatever reason, we are notified of those submission failures in real time, and we have a team that will reach out to you within just a couple of minutes. Typically, they will send you an email letting you know that we've received a submission failure and that we're reviewing it, or if they already know why it failed, we'll give you that particular reason. But we do have a dedicated EAP support team that is here to help you. So please reach out to us directly if you need that assistance.
Absolutely. Yep. And feel free to reach out to me as well. I know every once in a while there's an issue with validating a writing number or an NPN, but that can be solved with one real quick phone call. So, like Anna said, CSG's got a great team over there. They can help get that taken care of, or just reach out to me and I can help facilitate that as well. So, I do not see any questions coming in at this point either. So once again, just want to thank everybody for taking time out of your day to jump on here with us. I hope it was very, very informative. I know it was on my end. She went over some things that I didn't even know on that. So Anna, certainly appreciate you taking time out of your day as well and jumping on here with us and going through this training.
Yes, absolutely. Have a great day and a great weekend, everybody.
All right. Thanks again, everybody. Hope you all have a great weekend as well.